We got a good show today. I'm excited. Well, we're covering it all. We're covering golf, professional golf. The guys are gone. They're on the West Coast. Well, they were. Now they're flying to Mexico. They're going to the East, Florida. We're going to talk about baseball. Very excited stuff and a whole lot of other things. Special guests coming your way, too, from the world of Hollywood. But speaking of Hollywood, not too far from the Hollywood sign, right here in Woodland Hills, California, BrightStar PT, physical therapy. That's brightstarpt.com. And we've got the founders in studio with us, founding partners, Masha Katz, yes indeed, and Savina.
Hello.
How are you?
Very good. Very excited to be here.
Yeah, first of all, thank you for being here. I know you drove a long ways to get here.
Our pleasure.
All the way
around that
upstairs.
That's right.
It's about time, right?
Mm-hmm.
Anyhow, thanks for being here. I'm excited to talk to you about a whole lot of stuff related to physical therapy.
We're ready.
Let's go.
Yeah, you can be the greatest, you can be the best, you can be the King Kong banging on your chest.
Hey, welcome back, ladies and gentlemen, live from Los Angeles, having fun. Sunday, 1 week away from the Super Bowl, and we got lots happening.
Name that tune with Burt Parks.
Yeah. Hey, by the way, I want to announce a new segment this week in Dodgers baseball, announcing that we're going to have some fun all season long on the network. If you're not a Dodger fan listening to us in Florida, well, oh well. We're going to have some fun anyways. Anyhow, we got a good one coming your way here, hanging out with Dr. Chris Lee. And in studio also, we've got the founders of BrightStar Physical Therapy. Believe it or not, their Woodland Hills location, located right here next to us. A couple other locations throughout SoCal. We've got Masha Katz and Savina Colmorgan. Is that close enough?
That's perfect. It's Colmorgan.
Oh, I got it.
Got it.
Valley Village, North Hollywood, and Beverly Hills. 2.5. Half in Beverly Hills and growing to a big shot. A little bit forward there, Masha. Great to have you ladies in with us this morning.
Thank
and
you.
What a specialty you have, and Chris Lee can back it up.
I've had my share of physical therapy visits over the years. I've had issues with like my rotator cuff and some other things. So I'm a big believer, and I think it's a must, especially not only when it comes to getting better from maybe, let's say, injury. I mean, you guys are the experts, obviously, but there's a lot of reasons why people come to physical therapy. Talk a little bit about how you guys got started. I mean, this is what, going back 2004 or so?
Yes, you're right. 2004. We met actually at a physical therapy course, and we just sitting having lunch, found out that we have a lot in common, and we started talking about probably going out on private practice together, and ever since then we've been together.
Boy,
working.
that's a
Here we are.
mouthful.
Here you are.
15 years. That's a
15
mouthful.
years.
Mm-hmm.
Both of us been very lucky and very blessed. A lot of people talk about partners and partnerships, and we're very, very lucky. I know I'm very lucky.
Yes, me too. And you're right. It's not common to have such a good relationship, but somehow we pulled it off, and we're here.
Let me ask you, the word chiropractor comes to mind because we've talked about lots of chiropractors, and with them over the many years we've been doing the show. Is there any relationship with what you guys do with physical therapy to what a chiropractor does, or is there a big difference?
We do. It's common. We're trying to fix people and help them out.
Right.
But I think the approaches are different. And where chiropractors have very manual and high velocity procedures that
Yeah.
they do to the spine and the neck and everything, what we do is a lot more, I think, long-lasting, because we treat people through exercise and really ultimately trying to change their lifestyle.
Okay.
And so actually, I think that our professions supplement each other.
Well, I want to just firstly interject here. I've had the pleasure of taking the tour a few times to the beautiful offices and the large space here in our building where we reside with the radio studio.
I'm jealous. I haven't
Thank
done this
you.
yet. I want to go
You're
take a
welcome
tour.
to come.
Yeah, I got to do
Short
this.
elevator ride.
I
man.
know, it's crazy.
I was so impressed. But I mean, we're talking from children to the older ones like myself and everything in between. Talk a little bit about, firstly, pediatric physical therapy and the reasons and why they need it. I mean, I can't remember. Adam's so old now, I forget when he was a kid.
Uh-oh.
I'm old, I guess.
Talk
Go
a
ahead.
little bit about
Go
that.
ahead, Mom.
Old
Yeah,
child.
yeah.
Well, one of the reasons children need physical therapy in general is because sometimes they're born with developmental disabilities. Sometimes they're born with certain genetic disorders. Sometimes they're born with very minor and mild orthopedic disorders. Something, for example, that we see a lot of in our clinic is called torticollis. Torticollis is when the baby is inside a woman and is laying possibly in an awkward position, and when they're born, their head tends to tilt to one side. Because they don't have good head control, their head kind of stays there to one side, and the muscles get tight. And as they're developing, they tend to look to one side more than the other. And as they're developing a little bit further, they tend to reach with one hand or one arm more than the other. Therefore, within a few months of that, or if we notice that sooner, or pediatricians notice that sooner, they start to need physical therapy. Another thing that happens with these babies, because they lay on one side, they start to have a little bit of a flattening of their skull bones. And I'm sure everybody has seen around little babies wearing cute little helmets. Sometimes decorated with butterflies.
My daughter had one. Now it's coming back to me.
Right. So very often those two go together.
Okay.
And we see a lot of these babies in the practice, and they're fairly easy and quick to correct as long as we catch it in time, just like everything else.
Sure.
I know that one thing that obviously stood out for me, just because I live with this, having my wife deals with scoliosis. You guys deal, or at least really specialize in that particular area. It's a big issue for a lot of people around the country, obviously. My wife in particular, and I understand what people are going through when they have that, just because I see it firsthand. Just talk about that and other treatments, a lot of ailments that you see on a regular basis, just because we want to, get people interested in trying to feel better. And that's kind of what this show is all about, living the good life. So talk about some of the things you guys actually see on a regular basis.
So this is a good question, because both me and Masha, when we started talking about, talking about starting a company together, we were talking only pediatrics.
Right.
And we actually were specialized pediatric physical therapy. And then little by little, we said, well, what about the parents of these kids? They need physical therapy as well. Okay, let's open it for the parents. And then we said, okay, so then that made us very special, because we were probably the only practice that specialized in both adults and pediatrics. But then Masha started really developing passion for seeing patients with scoliosis, which comes along with pediatrics and even adults. So that tied it together. And she'll tell you probably a little bit more about how she started specializing with this about, what do you think, Masha?
7-8 years ago.
About 7-8 years, I was going to say 10. And so we really have developed that area. And then we said, why just physical therapy? Maybe we need to include our therapies as well. And so now we have occupational therapy as well as acupuncture. And so we really have broadened our practice. And I think still the same thing comes across through our practice for the last 15 years, which is we want to take care of our patients. We love our patients, and we want to have them have fun and us have fun while doing it, and just really make a difference in their life.
Had the pleasure of talking with you, Masha, about the cranium treatment and therapy. Talk a little bit about that. That's novel and
Yeah, Savina gave me a
more
little
recent.
insight on you
Yeah.
clearing a headache within 10 minutes. I got to hear about this.
That was pretty magical.
Come on.
Okay. There is a therapy out there. It's been around for actually quite a long time, and actually goes back way longer than what we know. We're talking about right now, different cultures, etc. This therapy is called craniosacral therapy. It's based on works of most recently a doctor. His name is Dr. Upledger, who started or discovered this. I'll tell you about it in a second. I think in 1970s. He passed away recently. He was a physician. He was studying to be a surgeon, and while in surgery or assisting in surgery, he basically noticed another rhythm within tissues that he couldn't account for, such as heartbeat or the blood flow. He noticed another rhythm. So from that came curiosity, what is that and what is that all about? And he realized that it is our craniosacral system or cerebrospinal fluid that goes between the ventricles in the brain and the spinal cord. And it has a specific rhythm as it flows through the body. And what he discovered through trials and tribulations and whatnot, that as you balance out the flow of this fluid, you basically increase the homeostasis of the body.
I love when you talk like this.
Yes. Keep it going. I like it.
Sorry, I don't want to talk too long. Or
No, it's great. I love that.
So it increases the homeostasis of the body. It allows the body to, like, for a lack of a better term, to heal itself or balance itself out. So what a lot of patients notice is it's patients who've had a minor concussion, patients who have a headache, patients who have been in a stressful situation, like, say, a car accident, or even emotional stress, which obviously affects our, for anything from our digestion, again, to headaches, to muscle tension.
To being married.
Occasionally.
Occasionally.
It does not apply to anybody sitting here,
Yeah.
obviously.
We're speaking with Masha Katz and her partner Savina Cole Morgan. They are BrightStar Physical Therapy.
And you guys are doing some great things here. Again, it's in Beverly Hills, Valley Village,
Woodland Hills.
Woodland Hills. And one thing, again, I want to remind all of our listeners about is that you're introducing now, as you mentioned briefly, acupuncture.
Yes.
Now, talk a little bit about that before we have to go to break, but I think this is kind of interesting.
It is very exciting, and like I said, it actually supplements our clinic because so many of our patients suffer from pain or musculoskeletal asymmetries, and so that is another way to approach pain. We as physical therapists approach it through massage, exercises, stretching, and different modalities, but acupuncture goes above and beyond that, and it controls sensors in the brain and the body that can obviously work on that as well. So this has been our experience that it will work very well in our practice, and we're very excited to have it.
Is this already ready to go?
Yeah, we're ready to go.
What about massage?
Massage is part of physical therapy. It's extremely therapeutic and helpful with all kinds of musculoskeletal injuries and pain as well, muscle spasm. There's so many people out there that are in pain and don't realize that a simple program of massage and stretching could be extremely helpful.
Like I woke up with a horrible pinched nerve today. I'm like dying.
Yeah,
I need to move on up.
Come on, we're ready to help.
Let's do it.
Talked about that short elevator, right?
Yeah, I know.
We also mentioned and saw the Pilates equipment in the office. Let's
That's
talk
right.
briefly about that.
Pilates is just another wonderful adjunct. It's an exercise that works on core stability primarily. Once the patients are primarily out of pain, this is a wonderful form of exercise. It's very helpful from young children to older adults. And we have a wonderful specialist who is doing it. She's been doing it for also like 25, 30 years on a reformer.
And I also wanted to add something very important, that all of these therapies that we are offering, Pilates, acupuncture, occupational, physical therapy for pediatrics and adults, they're all covered through insurance. And because we've been around for so many years, we probably are one of the very few places that takes the majority of insurances, especially for pediatric care. We are probably the only place in the valley that takes insurance.
Wow, that's a big deal.
It is a big deal.
Most importantly, go to brightstarpt.com. That's probably the best way to go.
And,
Yes, thank you. Great to be here.
Tell a friend.
Thanks, guys.
Tell a friend, and we're going to be featuring the ladies for the next 5 months, so we'll be talking about their services and practice every week.
Absolutely. Don't forget to come for a free consultation.
Free, our favorite word.
There
Free.
you go.
When the best